Okay, so very warm good evening to all. So here we are going to discuss about the key core FMGE topics, and as a continuation of the last part, and maybe we'll because there was a lag in the initial part, we'll repeat that upper limb and lower limb also, and how to approach this FMGE questions. There are some key areas that we have to concentrate. In case of FMGE, there are some key areas which we need to concentrate. So that areas only we are going to discuss. Okay. And these topics will be one of the most core related topics which are frequently asked in the exams, in the FMG exams. And that part we'll try to see here. And this is the thorax. We will start with the thorax. Okay. Now in thorax there are many topics, but as such we have some high yielding topics like surface marking of the thorax, and we have external features of the heart. Blood supply of the heart is a common question, and external features of lungs and bronchopulmonary segments. These are the most high yielding topics if you want to just start FMG, or if you want to revise that part of FMG questions. These topics are very important here. Now we'll first go to the surface markings. Now what is there in the thorax? Imagine yourself. Now these topics have additional view in these topics. And what is there in the thorax? We have thoracic cage, then we have heart and lungs. That's all. And some additional blood vessels and structures are there. The first thing is that surface marking. We'll just see a question now. Now what is asked here? Okay. Now what is the question? Inferior angle of scapula is corresponding to which vertebral level? The options are straightforward. This is a straightforward factual question in the surface marking of thorax. Inferior angle of scapula is corresponding to which vertebral level? We'll see a diagram here. This is a surface marking on the posterior aspect of the thorax. We are viewing it from the back. Now what we view here, this is called the C7 vertebra. Now this C7 vertebra, so this C7 vertebra is nothing but, okay, so C7 is called vertebra prominens. C7 is given a name called vertebra prominens. Okay, so what is vertebra prominens? Okay, so when you just touch on the back of your neck, okay, you will feel a prominent region on the vertebral prominence. That is called vertebra prominens. So that is the only thing we can see. So we cannot able to palpate. Actually, how many vertebrae are there in the cervical region? We got 7 cervical vertebrae. We have 8 nerves, but 7 cervical vertebrae from C1 to C6. Can we palpate to C1 to C6? We cannot able to palpate. We can able to palpate only the C7. The first vertebra which can be palpable, the spinous process which is palpable, is called C7 vertebra. So this is called vertebra prominens. When we go down, as I told you, there is no C8. We got T1, T2 and T3. Now T3 corresponds to a level of, what is this? This is the scapula. So what are the parts of scapula? We have, this is the scapula, and here we have a spinous process of scapula, and this part is the lower lateral border. This is the medial border of scapula. This is the lateral border of scapula. This is called spinous process. Okay. Now this spinous process at the root is corresponding to which level? It is corresponding to the T3 level. So T3 vertebra is corresponding to the spinous process. This question can come as the spinous vertebra process of scapula is corresponding to which level? It is T3. Now you see here, this part is called the inferior angle of scapula. Inferior angle of scapula is corresponding to which level? It is corresponding to the T7 vertebra. So inferior angle of scapula is corresponding to the T7 level. Spinous process is corresponding to the T3 level. These are the main, and sometimes the question can be, what is vertebra prominens? That is C7 vertebra. They won't ask you what is T1, T2. One more vertebra which is commonly asked is called T4 level. Note down this point. This T4 is called an angle called sternal angle. So what is sternal angle? Now if you see in the anterior aspect, this is the posterior aspect, we got a sternum, and this part is called, it's like a tie. Okay, so this is called the manubrium sternum. Manubrium sternum. This is called body of sternum. Okay, If you view the central part, we have a manubrium sternum and body of sternum. If you view it from the side, it will appear like this. So the manubrium sternum will appear, then body of sternum will appear. Here, can you see it is forming an angle? So this angle is called sternal angle, or is called angle of Louis. Angle of Louis. Okay. So sternal angle or angle of Louis. Now, what is this corresponding in the vertebra? The sternal angle or angle of Louis corresponds to T4 vertebral level. Commonly asked question is, what are the events that happens at the T4 level? Okay, one of the major event that is asked in the MCQ is that arch of aorta will start here and arch of aorta will end. So we got an aorta. So this is the ascending aorta starting. Then it is called arch of aorta. Then it becomes what? Descending aorta, ascending aorta, arch, descending aorta. Okay. Now arch of aorta starts at T4 level. It ends at T4 level. It is starting like this and then ending. Both the event happens at the same level, that is called angle of Louis. Okay. So these are the commonly asked surface marking question. Sternal angle is at the level of T4, spinous process at the level of T3, vertebra prominence is C7, and inferior angle of scapula corresponds to T7 vertebra. Okay. Now the second question, as I told you, what is commonly asked? What is thorax? Thorax is nothing but a thoracic cage. Okay. Now thoracic cage is having, what are the parts of thoracic cage? We got a vertebra on the back, then we got ribs on the side. The ribs will come on the side. It is attaching to, or it is articulating with the sternum on the side. Now between the ribs, what is that space is called? That space is called intercostal space. Anatomy, everything is. Now what is neurovascular bundle? Okay. Now, what is neurovascular bundle? Between the two intercostal, between the costa, between the ribs, we got a space that's called intercostal space, and the ribs have a space that's called intercostal space. What will be there in the intercostal space? We will have neurovascular, sorry, innermost intercostal. Then we got some fascia. Okay, that fascia we'll see now. So we got external intercostal, internal intercostal, and innermost intercostal. Then we have a fascia that's called endothoracic fascia. Okay, some questions they might confuse with this transverse abdominis muscle, but transverse abdominis muscle is not related to this intercostal space. Okay, so when you one more question can come, what are the structures which are pierced by a procedure that is called thoracocentesis? This is a commonly asked topic that's called thoracocentesis. So the word is called thoracocentesis. Centesis means we are applying it is an invasive procedure. We just put a needle into the intercostal space and we will try to draw the pleural fluid. That procedure is called thoracocentesis. Now what are the structures? The question can come like, just you will pierce. Okay, I'll tell you the sequence. The sequence is, we will be piercing external intercostal, internal intercostal, innermost intercostal. Then we got a fascia that's called endothoracic fascia. Inside that, what will be there? We will be having a parietal pleura. Okay, parietal pleura. So if they ask you for thoracocentesis, you can go up to parietal pleura. Can we go to the visceral pleura also? No. Between the parietal pleura and visceral pleura is the pleural fluid. We will go up to the parietal pleura, then we will draw up the pleural fluid. Okay. Now the question is not related to this. Now we got neurovascular bundle. Now this is just a schematic diagram to show you. So how the ribs will be? The ribs will be like this. We got ribs on either side. This is the vertebral end of the ribs and this is the sternal end of the ribs. Sternal end of the ribs will stop like this. Okay. And this is the vertebra and we have sternum in the front. Okay. Between the two we'll have a costal cartilage. Okay. Now if I cut this vertebra and see it on the side, it will appear like this. Okay. So this is the vertebra. Now this is the upper end of the vertebra. This is the lower end of the vertebra. Are you following? We are just cutting it and viewing it from the side. We'll have an upper end and lower end. This is the anterior part and this is the posterior part. Now on the inferior aspect, you will see a groove here. This groove is called costal groove. What is the name of the groove? Costal groove. The structure of the rib will have an upper part and a lower part. It will be just like this. Okay, so in the upper part, this is the this is the lower part. In the lower part, you will see a small groove that's called costal groove. Now in the costal groove, we'll have all the neurovascular structures. The structures, neurovascular structures will be present here. Okay, vein, artery and nerve. So vein structures they see. One more question is there, like what in here will be like a vein, then vein will be above. So vein is there, then artery is there, and then we have the nerve. So this is called vein structures, vein, artery and nerve. This vein structures will be passing in the groove. So here we got vein, artery and nerve which are running in the costal groove. Okay. Now what is the arrangement of structures? First, this is called external intercostal. I am putting a needle like this. Okay. So what are the first structure that will pass? That's called external intercostal. Then this is called internal intercostal. Okay. Then we got innermost intercostal. Then this is called what? Endothoracic fascia. Last structure is called pleura. Okay, what part of the pleura? It is called costal pleura. Some books will give costal pleura as a thing. It is nothing but the parietal pleura. Parietal pleura, each area it is given a different name. Parietal pleura in the mediastinum is called mediastinal pleura. In the costa, it is called costal pleura. Okay, it is nothing but parietal pleura. The question can come in either way. So what is the answer for this? Between the internal intercostal and innermost intercostal, this is the neurovascular plane. So we got external intercostal, then internal intercostal, innermost intercostal. Between the internal and innermost intercostal, we got a plane. This plane is called neurovascular plane. Okay, now one more question can come in the same topic. There are some multiple questions. One more question is that where will you put the needle? So where you will put the needle? The question options can be upper part of the rib, lower part of the rib, upper part of the lower rib, lower part of the upper rib. The question can come either. So if you put a needle here, the chances of injuring this is more. So you should not put the needle here. Okay, so you should put on this region. You should put on the upper border of the lower rib. So note down this word. You have to put on the upper border of lower rib. Okay, so this you mark it. So you should put the needle in which part? Into the upper border of the lower rib. Why? Because you are if you put, this is the space I need to put. If I put the needle here, I will injure the neurovascular bundle here. So if I put in the upper border of the lower rib, we can take it, this is the first rib, this is the second, not first rib. We can take like third rib and fourth rib. Where we have to put? We have to put in the upper border of the lower rib. So if you put the needle here, this is the right way. Should not put on the lower border of the upper rib. Okay, can you understand the concept? This is the location of the neurovascular bundle on the costal groove. So in the rib cage, we have a groove on the lower part that is called costal groove. What are the intercostal space? The muscles are external intercostal. Even we will have skin superficial fascia. If we leave that part, what is the first muscle we will get? We will get an external intercostal, then internal intercostal. Between the two, we have a neurovascular bundle, innermost intercostal. Next is called endothoracic fascia, then pleura. What is the pleura here? It is called the costal pleura. So these are the structures that will be pierced by this nerve. Now how the structures are arranged in the costal groove? Vein structures, vein, artery, nerve. What is a vein? Intercostal vein, intercostal artery and intercostal nerve. Where you have to put the needle? You should not put in the, or you just remember, if you have two things, don't try to read both. You should remember this alone. Which is the correct part? Upper border of the lower rib. Okay, upper border of the lower rib to avoid injury to the neurovascular structures. Okay. Now a question can come. This is a simple, straightforward question, which is called a floating rib. It's a simple question, factual question. What are floating ribs? How many ribs we have? We have 12 ribs. In this 11th and 12th are called floating. So 11th rib and 12th rib is called floating. Why it is called floating? Because this is the ribs which is not attached to the costal margin. If you see the rib cage, so we have first rib, we have second rib, we have third, like that it will come up to sixth it will come. Then from 7 onwards, 7, 8, 9, 10 will form a margin that is called costal margin. So the first rib will articulate with the sternum, second rib also articulates, third rib articulates, fourth rib articulates, fifth rib and sixth rib also articulates. From 7 onwards, from 7 to 10, they form a margin. This margin is called costal margin. It's not coastal, it is called costal, C-O-S-T-A-L, costal margin. So after this, there is no space. So what will be the 11th and 12th rib? It will just float here. It will not be related directly to any structure of the thoracic cage. Okay, so it will be floating on the back only. It will not come to the front at all. So that rib is called floating. So what are the floating rib? 11th rib and 12th rib is called floating ribs. So what ribs forms the costal margin? If they ask you, it is 7 to 10 forms a margin that called costal margin. Okay. Sternocostal ribs from directly from the first rib to the sixth rib are directly articulating the sternum. Okay, next we'll move on to from the thoracic cage. What is inside the thorax? We'll have heart and lungs. First we'll see the heart, then we'll see the lungs. External features of the heart, commonly asked question, which of the following forms the base of the heart? Which is forming the base of the heart? Chambers of the heart. We must have learned from higher secondary, 4 chambers, right atrium, left atrium, right ventricle, left ventricle. What is the structure that is forming the base of the heart? What is the structure? We can see one more question. By the way, if you just see that, okay, we can answer these questions. It is between external oblique and innermost. Okay. Now, what is the structure that forms the base of the heart? Before that, we'll see that, then we will come back. Second question is, right border of the heart is formed by all except. So there is a border called right border. What is the structure that is forming except question? Okay. Now this is a schematic diagram I have drawn. So in this diagram itself, we can answer many questions. Okay. Now heart, the shape of, what is the shape of the heart? It is not the shape of the heart. Okay. So what is the shape of the heart? The shape of the heart is like this, a truncated cone. Now to understand this, what is this? This is a pyramid. Okay. Now if you imagine the pyramid is lying like this. So in a pyramid, which is called an apex, this is called the apex of the pyramid, and this is called the base of a pyramid. This is called the apex of a pyramid and base of a pyramid. Now if you apply the same thing, you just keep this apex like this. Okay. You are tilting the pyramid on this way. This is called a truncated cone-like structure. Now apex is like this. This is the base. Now the pyramid has fallen down. So this is the shape of the heart. Why I am insisting on this part? Because most of the students will commonly make a mistake and say this is the base of the heart. This is not the base of the heart. Okay. Now heart has got some structures. What are the structures? We need to know what is an apex. Sorry. I think it's visible. So there is an apex of the heart. Then we have a base of the heart. We got a right border. Then we have left border. Apex, base, right border, left border. Then some surfaces of the heart. What are the surface of the heart? We got a sternocostal surface and a diaphragmatic surface. Okay, so diaphragmatic surface, sternocostal SC surface. Okay. Now what is this apex of the heart? Okay, now this chamber, okay, now this chamber of the heart is forming the apex of the heart. So apex of the heart is formed by what chamber? This is the left ventricle. So left ventricle forms the apex. That's the first question. Apex beat is formed by what chamber? Now we have heart is like this. Okay, you must have seen in higher secondary. We got a right atrium, right ventricle. Sorry, I think I'm hiding that. Left atrium, left ventricle. Okay. Now you just to imagine that this four chambers are tilted like this. So apex is formed by what chamber? We'll skip this. So apex is formed by what chamber of the heart? Left ventricle. This is the first question. Apex is formed by left ventricle. Now what I told about this pyramid, the opposite to this is the base. So apex of the heart is this one. So which will be the base of the heart? The base of the heart is here. So base of the heart is present on this area. But you are not seeing anything on this area. Why? Because it is usually masked by the greater blood vessels. What are the greater blood vessels? We got SVC and we will have one more IVCs here, superior vena cava, inferior vena cava is here, and aorta is there, pulmonary trunk. All these structures will mask this part, so you cannot see the base of the heart as such. So base of the heart is formed by what? It is formed by a chamber that is called left atrium. It is hidden here. So left ventricle is here, left atrium is there on the back side. So apex of the heart is formed by left ventricle, base is opposite on the back. You can see only on the posterior aspect, it will be like this almost. Okay, so there will be, we got four pulmonary veins that will open into a chamber that is called left atrium. So left atrium is there on the posterior aspect. This chamber will be like this. So how many pulmonary veins are there? We got four pulmonary veins that will open into the left atrium. Okay, so base of the heart is formed by, if the question is asked, left atrium. Now what forms the right border of the heart? Okay, what forms the right border of the heart? So what forms the right border? You can see in this picture itself. Okay, so this is the right border of the heart. This from here to here, this is the right border. So right border of the heart is formed by, maybe we can say a part of superior vena cava, but mainly by what chamber? It is the right atrium. Don't say left atrium here. Left atrium is there somewhere behind. You cannot see that. So this chamber of the heart which is forming this, where the superior vena cava will open. So right atrium is like this. On the top we got superior vena cava, on the bottom we got inferior vena cava. Both of them will open into a chamber. This is called right atrium. So we got SVC, IVC will open into the right atrium. So which chamber of the heart will form the right border? The answer should be right atrium. Okay, which chamber will be forming the apex? That will be the left ventricle. And which will form the base? The base is formed by left atrium, which you cannot see, that is there on the back. Now what forms the left border of the heart? Left border of the heart is also formed by the left ventricle. Maybe a part of this, some option can have left auricle also. So the option can be left auricle plus the left ventricle. That is also correct. What is auricle? Auricle means like auricle is pinna. We have a pinna shaped structure here that is called left auricle. That left auricle also forms the left border along with the margin of this chamber, the same margin, it's called left ventricle. So left auricle and left ventricle forms the left border of the heart. Right atrium, some option can give superior vena cava also. Initial part of superior vena cava can be given as an option in the right border of the heart. So we finish the right border, we finish the left border, we finish the apex and base. So what are the surfaces of the heart? We got a surface here, sternocostal surface. So if you, here we have sternum and then costa. If you remove that inside this part, so this entire surface of the heart is called sternocostal surface. It's not the border. The entire surface, what you are seeing here, what is the name of the surface? This is called sternocostal surface. So if a question comes, what chambers will form the sternocostal surface? What are the chambers you have to write? You have to write right atrium, along with that right ventricle. So right atrium and right ventricle will form the sternocostal surface. If a question comes, what will form the left surface? There is one more surface called left surface. it should be left ventricle along with left auricle also we can say. So sternocostal surface is mainly formed by right atrium and right ventricle. Left surface, this part, this entire. See the difference between the border and border is nothing, just a line. Surface means entire surface. Okay. So entire surface is formed by right atrium and right ventricle. Left surface is formed by the left ventricle. Okay. Now one more surface we have just missed this in this discussion. This surface. Okay. The part which is present here. What is the name of the surface? This is called diaphragmatic surface. Why it is called diaphragmatic or diaphragmatics? Because this surface is the one which is lying on the diaphragm. So we got a muscle here. What is the name of the muscle? Diaphragm. Okay. So this surface of the heart which is lying on the diaphragmatic surface, diaphragm is called diaphragmatic surface. The diaphragmatic surface is formed by what chamber? Don't have space I write here. It is formed by both right ventricle and left ventricle. When you just lift it like this, you will see the heart is lying like this. Between the two, there is an interventricular groove. We got left ventricle and right ventricle. Right ventricle will be anterior, left ventricle. So this is how the heart is placed. So diaphragmatic surface is formed by left ventricle and right ventricle. So in this slide itself, we covered the entire part. So just a recap, we got apex is formed by left ventricle, base is formed by the left atrium, right border is formed by right atrium, left border is formed by left auricle and left ventricle, and sternocostal surface and diaphragmatic surface. So if we just repeat this question, right border of the heart, when you just try to understand an MCQ, okay. Now, right border of the heart is formed by all except, we can have right ventricle, we can have SVC, sorry, right atrium can be there, right, superior vena cava is there, inferior vena cava is there. We cannot have right ventricle in the right border. As I have told in the option, we got superior vena cava, we can include inferior vena cava. This part is called the right atrium. So this chamber is called atrium. So in the right atrium, superior vena cava and inferior vena cava will open, and all this include as a part of inferior vena cava. Only the initial part is there. Sometimes the option can be only superior vena cava and right atrium. Sometimes the option can be superior vena cava, right atrium, and like inferior vena cava. Okay. So this is the, which are the following forms the base of the heart? Now we can answer. It is the left atrium. Okay, it is not right atrium, it is not right ventricle, it is not left ventricle. The base of the heart is formed by right atrium. Sorry, base of the heart is formed by left atrium. Okay. These are the questions commonly asked in the related to the structure of the heart. Okay, it's better now. One more topic which is commonly repeated in the FMGE exam is the blood supply of the heart. Okay, it's a very important topic because myocardial infarction is related to this. And what are the structures which is there? Blood supply of the heart. Blood supply of the heart, we'll see a question. All of the following are supplied by right coronary artery except. Okay, they are not asking the branches, they are asking about the supply compartment or the chamber of the heart supplied by the coronary arteries. Right atrium, SA node, posterior part of IV septum, anterior IV groove. We will come to that later. Now, the same diagram, similar diagram, I have just added the blood supply in this diagram. Okay. Now, how many coronary arteries we have? We have right coronary artery. Okay. Now, if we just draw this, so where is this coronary arteries are coming? The coronary arteries are coming as a branch of ascending aorta. A question can come, what is coronary arteries? Coronary arteries are branches of, they are vasa vasorum of AA. What is AA? Ascending aorta. So this part is the ascending aorta. Then we got arch of aorta. Then it will continue as descending aorta. This, it will go like this. So this is the arch of aorta. This part is the ascending aorta. Ascending aorta has a additional. So what is vasa vasorum? A blood vessel of a blood vessel is called vasa vasorum. It is not actually a branch. What they say, the aorta is there. On the side we have a blood vessel that is called vasa vasorum. So vasa vasorum of ascending aorta is and ascending aorta. Usually in the aortic valve, we'll have 3 cusps here. So 2 cusps will be called coronary cusp, one is non-coronary cusp. So there will be 2 coronary cusp and 1 non-coronary cusp. We'll discuss later on if time permits. We'll see the, so these 2 arteries will come from the coronary cusps. Okay, 1 non-coronary cusp and 2 coronary cusps is there. Now we'll see only the branches here. Coronary arteries are coming from as a vasa vasorum of ascending aorta. How many coronary arteries we have? We have right coronary artery and left coronary artery. I'll tell the course, then we'll discuss the branch and the chambers it supplies. Now, right coronary artery, what is the course? It will come like this. So, right coronary artery will start here, and then it will directly come on a groove. This groove is called AV groove. Okay, what is this AV groove? Between atrium and ventricle, if we have a groove, can we call it as atrioventricular groove? So, this groove, the right coronary artery will come. When it is coming, it will give branches. You can note down the branches here. These branches, what is this chamber? Right atrium. So these are called atrial branches. These branches are called atrial branches. It will also give branch to the ventricle. This is called ventricular branches. Mainly the branches to the right ventricle. This chamber is right ventricle, this right atrium, this is right ventricle. So when it is coming from the right coronary artery, it will give atrial branches and ventricular branches. After that, what it will do? It will go and reach the inferior border of the heart. So the border which is present here, this is called inferior border. Then it will go behind. So this is the anterior part of AV groove. Then we got a posterior part of AV groove. It will go behind and anastomose with the branch of the left circumflex artery. This is called circumflex artery. Okay, you can see in this picture also. This artery is called circumflex artery. Circumflex artery is not a branch of right coronary artery, it is a branch of left coronary artery. Both of them will anastomose here. At this point, both of them will anastomose. Again, I will repeat. This right coronary artery will run in the AV groove, anterior part of the AV groove. It will reach the inferior border, then it will go behind. It is a posterior part of the atrioventricular groove. Between the atrium and ventricle, this posterior part of the atrioventricular groove. It will anastomose with the circumflex branch of left coronary artery. This is the course. Now, what are the branches of this right coronary artery? Now, it will give a atrial branch. First is, we have seen that atrial branch. Now, one of the atrial branch is called SA nodal artery. So, where is the SA node? The SA node is present here. The artery is called SA nodal artery. SA node is the pacemaker of the heart. The pacemaker is most commonly, SA nodal artery can come most commonly, 60% is from the right coronary, sometimes 40% can come. So, most commonly it is coming from the atrial branches of the right coronary artery. In 40% of the individuals, it can come from the left coronary artery also. So, that is the first branch, atrial branch. When it is reaching this margin, you can see it is reaching the inferior border, it gives an artery. This is called right marginal artery. Right marginal artery. The second branch is called right marginal artery. On the margin, it is giving a branch, it's called right marginal artery. So, main branches are, and along the atrial branches, sometimes it will give a branch that is called conus artery. What is cone here? Now, this pulmonary trunk, when it is starting, that is like a cone. Okay, it is like a cone, or it is called infundibulum. So, it gives a branch to this that is called conus artery. Conus artery is a branch to the infundibulum of the pulmonary trunk. Near this part, the artery is called conus artery. So, atrial branch, ventricular branches, conus artery. Then, when it is coming here, it gives a branch that is called right marginal artery. Okay, now this is the right marginal artery. So these are the main branches of this. We also got AV nodal artery. Sometimes it will give a branch to the AV node also. This is called AV nodal artery. Okay, so these are the branches of the right coronary artery: atrial branch, ventricular branch, SA nodal artery, conus artery, right marginal artery, and AV nodal artery. Now we'll just go to the left branch. So To get the space, I am just expanding this part. Okay. Now, what are the branches from the left coronary artery? LCA, left coronary artery. You can see what is the course of this left coronary artery. This artery will start from here, the same thing, like a vasa vasorum of ascending aorta. That's the first point. Then it has a beauty. Now it is not directly, this artery will run like this. Right coronary artery is running throughout as right coronary artery. But this artery, as soon as it comes out, it will trifurcate. It will trifurcate, mostly trifurcates into a branch called, this is called circumflex artery. So as soon as it comes out, it is not going in the AV group. You see here, immediately it will divide into a branch called left circumflex artery. What do you mean by circumflex? Circumflexing means it is winding around. This is artery, this is called left circumflex artery. Okay. Then it gives a branch here. This is called LAD. LAD. What is LAD? Left anterior descending artery. This artery is descending down. This artery is descending down. This is called LAD, left anterior descending artery. One more name for this is called anterior IV artery. Anterior interventricular artery. That is also one name. Okay. One more thing I missed on the last part. We can include that as posterior IV artery. Posterior interventricular artery. You see here when it is going down, it is giving a branch here. This is called posterior interventricular artery, because there is one more topic called coronary dominance, and we will see that. So these are the main branches. Posterior interventricular artery is commonly from right coronary artery. Okay. Now what happens, I told you, left coronary artery will start here. It will trifurcate into three branches. Left circumflex, it will go circumflexing. One is descending down, that is called LAD, left anterior descending, and last is called left marginal artery. Okay. Along with the marginal, one more artery will come, that is called diagonal artery. Okay. So once the left coronary artery is coming, it is giving a circumflex branch. One is descending down as LAD. One is going as diagonal artery, and one to the margin is called marginal artery. Marginal artery. So trifurcation, or we can say tetrafurcation. 4 branches also it can give, because the marginal artery sometimes it will come from the diagonal. Okay. So usually it will trifurcate as left anterior descending and diagonal artery and circumflex artery. Now what happens to the circumflex artery? The circumflex artery will wind around in the AV groove, posterior part of the AV groove. It will anastomose. This anastomose we saw that part. That is, it is anastomosing with the right coronary artery. So question can come, which artery will anastomose with which artery? Right coronary artery will anastomose with the left circumflex branch of left coronary artery first. Now the second question is, what is anastomosis happening here? Posterior IV artery is anastomosing with anterior IV artery. Posterior interventricular artery is anastomosing with the anterior interventricular artery. What is the name for other name for anterior interventricular artery? It is LAD, left anterior descending artery. Left anterior descending artery will anastomose on this part. Posterior IV artery is a branch of which artery? Right coronary artery. Anterior IV artery is a branch of left coronary artery. Okay. Now, one more question can come in this same topic. What is coronary dominance? Coronary dominance. What is coronary dominance? Now, if right coronary artery supplies the or branch from into posterior IV artery, it is called right coronary dominance. If left coronary artery branches out as left coronary artery. Why? Because this posterior IV artery can come from right coronary artery also. Sometimes this artery will stop here. Now this artery will go. It can be a branch. So this is called posterior IV artery. If it is a branch of right coronary artery, that is called right coronary dominance. If it is a branch of left coronary artery, so which artery can come? The circumflex artery will come up to here. The circumflex artery will give a branch. Don't expect this will go. Okay. Either it can be from right coronary artery or it can come from circumflex artery. But which is common, almost 80 to 90% of the people are right coronary dominants. If you take 10 people, 8 people will be having right coronary dominants. Only 10% or 10 to 20% will be left coronary dominants. It will be a branch from the left coronary artery. So I have given most of the topics or most of the branches from this right coronary artery and left coronary artery. Mostly the questions will come from this area. And what is the chambers that will be supplying by this? It is, if you understand the branches, chambers writing is easy. Okay. All of the following are supplied by the right coronary artery except. Now just apply the rule. So where we saw the course of right coronary artery was coming like this and then going like this. Okay. So will it supply the right atrium? Yes. SA nodal artery, most commonly it is from this. Okay. Posterior part of IV septum, anterior part of IV septum. As I told you, the right coronary artery will go behind and it gives the posterior IV artery in most of the individuals. So posterior IV septum is supplied by commonly 80% will be supplied. But anterior part of IV groove cannot be supplied by the right coronary artery. Why? Because we got left coronary artery only will come, it will give circumflex and it will descend as LAD. This LAD is the one which will supply the anterior part of the interventricular groove. If we draw the heart here, I'm sorry. So this is the heart here. We got an interventricular groove. It has an anterior part and a posterior part. So LAD only supplies the anterior part. So what is the answer for this exception question? So the answer is anterior part of IV groove. So that's why I'm saying that if you understand the branching out, you can apply the common sense and answer the question. Whatever chambers if they ask, you can answer this. So always follow this chart and then try to answer the questions. SA nodal artery is commonly from which artery? The question can come, that is called right coronary artery. Conus artery, posterior IV artery, which is commonly coming from right coronary artery. Okay. Now we'll move on to a topic, a commonly asked topic, that is called lung external features. Sorry. Okay. Now external features of the lung. What is external features of the lung? The external features of the lung. Now what is where is the lung? Lung is located on either side of the heart. We got in between the heart. One more topic that can be asked is what is mediastinum? What is mediastinum? Between the two lungs, we got a space. The space between the two lungs is called mediastinum. So, and a question can come: what are the types of mediastinum? We got superior mediastinum and inferior mediastinum. And we will just explain that part. And then you can go to the lung. Okay. Now we got lung here. So we got a lung here. We got a right lung here. And then we got a left lung here. Between the two, the space is there. This is where the heart is there. So heart is lying in a space between the two lungs. This entire space is called mediastinum. Okay, got this point? This is called mediastinum. Mediastinum is what they say is that it's nothing but a septum. It's not a space. The septum between the two is called mediastinum. Middle space. It means middle space. Now, if you just view it from this side, we have to draw the diaphragm like this, and we got the sternum here. Okay. Now there is an angle of the sternum, that's the sternal angle. Okay. Now we have a lung here, and we have the heart is present here. I'm sorry, you can put like this. Okay. So this is the sternal angle. Now if you draw an imaginary line in the sternal angle, the above this line, this mediastinum is called superior mediastinum. Okay. What will be there on the back? That will be the vertebra. So this is nothing but the vertebra. Okay. The sternal angle will be at which vertebral level? T4 level. It will go up to this some vertebra. Okay, maybe up to T12 it will go. So here T4, if you draw a line, it will be intersecting in sternal angle. The part of the mediastinum, part of the space above that, now what we have done is we have removed the lung, we are viewing from one side. So the sternum is here, this is the manubrium sternum, this is the body of sternum, manubrium and body of sternum. Posteriorly we got the vertebra. Okay, you are drawing an imaginary line at the T4 level, that angle called sternal angle. Above that, the space is called superior mediastinum. Below this space, this entire space is called inferior mediastinum. Got the point? Superior mediastinum and inferior mediastinum. Now, inferior mediastinum is again divided into three parts: an anterior part, a middle part, and a posterior part. So, inferior mediastinum is divided into an anterior mediastinum, middle mediastinum, and posterior mediastinum. Okay, what is anterior mediastinum? The space between the sternum and heart is called, in correct sense, the space between the pericardium, because heart is covered by a layer called pericardium. The space between the pericardium and the sternum is called what? Anterior mediastinum. The space where the heart lying is called middle mediastinum. The space between the heart, posterior border of the heart along with its pericardium, and the vertebra, this is called posterior mediastinum. Okay. Anterior mediastinum, the question can come like, what are the boundaries of anterior mediastinum, what are the boundary of posterior mediastinum? If you understand this diagram, this is over. Above the sternal angle, the mediastinum is called superior mediastinum. Below the sternal angle, the entire structure is called, entire space is called, it is divided into an anterior part and a middle part and a posterior part. Behind the sternum, in front of the aorta, in front of the heart, that is anterior mediastinum. The heart itself is lying in the middle mediastinum. Behind the heart will be the posterior mediastinum. Okay, so how many mediastinum we have? We got 4 mediastinums, or we can say 1 plus 3. The 1 is a superior, the 3 are together called inferior mediastinum. Okay, because that question I didn't cover, but that topic can come. Just have from this idea, you can write the borders of the mediastinum. Okay. Now, what is there in the external features of the heart? We'll see a question. All of the features are present on the mediastinal surface of right lung except arch of aorta, azygos vein, SVC, IVC. Mediastinal surface of lung, what is there on the right lung, what is there on the left lung. I will come back to that. It's just a schematic diagram to show the mediastinal surface of the lung. Okay. Now, what is there in this? So, what we have lung, we have a right lung and of the heart. Okay. The base will be lying on which? It will be lying on a thing, lying on a muscular aponeurotic structure. What is it called? This is called the diaphragm. Okay. Now, this part will be lying here. What I told about this region, this is the mediastinum. Now, we just open this and see. This part is called, for how many surfaces, the external features of the lung, what are the parts? First is apex. Almost it's like heart, no? So, we got a base of lung. Then we got surfaces. So, what are the surfaces of the lung? Surfaces of the lung are costal surface. Okay. Then we got mediastinal surface. Mediastinal surface, costal surface, and last is called diaphragmatic surface. Okay, diaphragmatic surface. So, how many surfaces are there? So, this part is called the apex of the lung, both lung. It is apex of the lung, apex of the lung. What is, apex of the lung? This is the apex. Base of the lung and base of the lung, base of right lung and base of left lung. Now, the surface which is present here, if we have the lung here, that surface is called costal surface. This entire surface is, that surface is called costal surface. Now, if you view it from this side and this side, so this part is the mediastinal surface of the right lung. This surface is the mediastinal surface of left lung. Am I correct? The surface which is present here is called diaphragmatic surface. One more thing we need to know, the borders of the lung. So, how many borders are there for the lung? These are pure basics. Okay, so we got an anterior border, we got a posterior border, we got an inferior border. So we got anterior border, posterior border, and inferior border. The sharp one, this edge of the lung is called anterior border, and we got a posterior border. We cannot see the posterior border. Posterior border will be on the back. Okay, so that border is called the posterior border, and this border of the lung which is present here, it will be like this. So this border of the lung which is present here, which is related to the diaphragmatic surface, this is called inferior border of the lung. This is the inferior border. This margin is called anterior border. Okay, behind we got a border that is called posterior border. So lung has an apex, lung has a base, lung has anterior border, posterior border, and inferior border. What are the surfaces of the lung? We got sternocostal surface, we have diaphragmatic surface, that is where the lung is present. If you view it from the side, we got a mediastinal surface. Okay. So this part is the one we need to know. We'll try to see some more details. So I just covered the surfaces of the lung, and if this is a structure of a right lung, now don't try to go to the details. We'll just try to apply common sense. So what is there in the right lung? We already studied that. What chamber of the heart that can come here? What is the chamber that is forming the right border, right atrium? That right border will be impinging or will be touching on which part of the lung? It will be touching on right lung. Obviously, it's not going to touch on the left lung. So right atrium is related to the right lung. Okay. Now, what is the blood vessel that is going into the right atrium? Superior vena cava. What is the blood vessel that is going to the from coming down from below? That will be inferior vena cava. So superior vena cava, inferior vena cava, right atrium. Can it form an impression there? Yes. Then trachea also will form an impression. So we have a trachea on the midline. It will form an impression on both lungs, especially in the upper part of the right lung. Okay. Then esophagus will also form an impression. So regarding the heart and the blood vessel, right atrium, superior vena cava, inferior vena cava, two tubes are there, trachea and esophagus. These are the main parts that will be forming an impression on the right lung. Before going to the features, mediastinal surface features, so what is the difference between hilum and root? So what is the difference between hilum and root? Is it same or different? Is it hilum is same or different? One way it is same, other way it is different. Okay, what is the difference between the root and hilum? Now, if you have here, the trachea is there, the trachea is going, and then we got a right lung, we got a left lung. Okay, what will be the other structure that will come? The pulmonary artery, only one branch, pulmonary artery, right pulmonary artery and left pulmonary artery will go. Pulmonary vein will come. How many pulmonary veins are there? We got 4 pulmonary veins. So here one pulmonary vein, here one pulmonary vein, here one, then all these veins are coming. Now if we have the structures is covered by a pleura. Now tell me, what is the pleura that will be covering this structures which are going inside? That pleura is called mediastinal pleura. So if we have a tube like this and structures are going in that, this entire structure is called root. Okay, root means the structures are covered by a pleura which is going into the lung and this lung. So that is called root of lung. What is hilum? If I cut down the structures, there will be an entry point, like an entry point of a door. So that entry point is called the hilum. Okay. Now what we have done here, I have just removed all the structures and we are seeing only the entry point. That entry point is called, given a name called hilum. Okay, root means the structures which is covered by a tube, mediastinal pleura, and then going. If you cut the structures and see from this side, that is called hilum. Okay. Now we'll see the structures in the right lung and structures in the left lung. Now we are applying the rule here. Now, what are the structures that will come to the right lung? This is called right hilum. Then we got left hilum. So this is a schematic diagram to show the right hilum and left hilum. We got right hilum and left hilum. Now, what are the structures that will be passing in the right hilum and what are the structures which will be passing on the left hilum? The right hilum, so you have understood that what is right hilum and left root lung. So right hilum means the structures which are going into the right hilum. What are structures that will go into this? Now, right lung, if you see that, I'm just seeing the right lung. Okay, we have an artery that is called pulmonary. We have a bronchus that is called epartial bronchus and hypoartial bronchus. Now, this is the hilum. Imagine this is the right lung. We got an artery. What is the name of the artery? Pulmonary artery. The only artery which you have to draw with a blue color. Why? Because it is carrying the deoxygenated blood. So that is pulmonary artery. We got pulmonary artery here. Now on the right side, above this pulmonary artery, one bronchus will be there. Below the pulmonary artery, one bronchus will be there. So that is called eparterial bronchus. Eparterial bronchus. Below that, one is coming. That is called hyparterial bronchus. What is this artery? Pulmonary artery. Which artery? We are talking about the right hilum. So that will be right pulmonary artery. Only on the right side, the bronchus will divide and go. The bronchus will divide and one will go above, one will go below. Above, epi means epithelium. Epi means outside. So epartial bronchus will be going above the pulmonary artery. Hypoartial bronchus will be going below the pulmonary artery. Okay. Then we got one rule we can apply most commonly. It's not given in books, but just take a clue for a loop. Anterior most structure will be superior pulmonary vein. For applying in the structures, inferior most structure will be inferior pulmonary vein. Most commonly seen. Okay. Now, if you take here, this is anterior, this is inferior, this is superior, this is posterior. This is the right hilum. So, which is the anteriormost structure? This is called superior pulmonary vein. Inferiormost structure will be what? Inferior pulmonary vein. We got all the structures. On the right hilum, we got a pulmonary trunk. Above that, we got epartial bronchus, and this is one I just zoomed it and showed you. Epartial bronchus and hypoartial bronchus. And anteriormost structure, if you apply the rule, it will be anteriormost structure will be what? The superior pulmonary vein. Inferiormost structure will be inferior pulmonary vein. That's all. One more structure is there called bronchial artery. What is this bronchial artery? This is the one which gives oxygenated blood supply to the lung. Because pulmonary artery is again giving only deoxygenated blood. Who will give the oxygenated blood? The oxygenated blood to the air passage up to the terminal bronchiole is given by the bronchial artery. So how many bronchial arteries we have? On the right side, we have one bronchial artery. On the right lung, one bronchial artery. On the left lung, we got two bronchial arteries. This also can be asked in MCQ. So right lung has only one bronchial artery, left lung has two bronchial arteries. You can see just above this bronchus, I have just to put a dot. The dot is the bronchial artery. On the right lung, we have only one bronchial artery. Okay. Now just have this in mind. Okay. I will just zoom and see the left, what you can say, left hilum. We have just seen the right hilum. Just one of space I have opened here. Now what is there in the right hilum? What is the rule I told you? Anterior most is superior pulmonary vein. Inferior most is inferior pulmonary vein. Okay. So here this is anterior, this is posterior, this is superior, this is inferior. If you apply this rule, what is this called? Anteriormost structure will be superior pulmonary vein, inferiormost structure will be inferior pulmonary vein. Over. Now here the bronchus will not divide into epartial and hypartial bronchus. We got only one pulmonary artery. If you take this lung, left lung, okay. In the left lung, we got how many pulmonary artery? Only one pulmonary artery is there. There is no, the bronchus will not go above this artery. The bronchus will go below only. So there is no epartial and hypartial. Can we call it as left principal bronchus? Because only one bronchus is going. Then only it will divide. So this is called left principal bronchus. We got this is pulmonary artery, left pulmonary artery. This is bronchus. Only one bronchus is there. That's called left principal bronchus. Superior pulmonary vein, inferior pulmonary vein. Okay. Now how many bronchial arteries I told you? Right lung 1, left lung 2. So you can see that I put 2 dots here. This is one bronchial artery and another bronchial artery. So you got 2 bronchial arteries on the left lung. So this is the right hilum, this is the left hilum. So maybe we can erase this part. So what we have covered is the surfaces of the lung. We have apex, base, sternocostal surface, deviation surface, and diaphragmatic surface. And structures in the hilum is a commonly asked question. What is the structure in the right lung? What is the structure in the left lung? Okay. Again, superior pulmonary vein is always anterior, inferior pulmonary is always inferior. Above downwards, it will be epartial bronchus, pulmonary artery, hypartial bronchus in right lung. On the left lung, it is usually pulmonary artery to principal bronchus. We got one bronchial artery on the right side, 2 bronchial arteries on the left side. Now, what you see here is the chamber of the heart that is called right atrium. Mediastinal surface, what is the chamber? Right atrium will be there. What is this blood vessel that is going? It is called superior vena cava. Superior vena cava is formed by the right and left brachiocephalic vein. You can see that joining together and form the structure here. Now, I have not drawn one structure. It will be present here. What is that? That will be the inferior vena cava. That is IVC. So, right atrium, 2 blood vessels will open. On the top, we have superior vena cava. On the bottom, we have inferior vena cava. And now, what is this vein that is opening into the right atrium? What is that vein that is opening into the right atrium? This is called azygos vein. Azygos vein. It is, to be precise, it is called arch of azygos vein. It is forming an arch and coming like this. So this is called arch of azygos vein. Will be present only on which hilum? Right hilum. So right hilum or right mediastinal surface, we got right atrium, superior vena cava, arch of azygos vein, trachea, then esophagus. This is nothing but the tubular structures is called trachea, and behind the trachea we have esophagus. Okay, what is this one I have shown? This is what we have just zoomed out and saw on the previous slide. That is the hilum. The hilar structures, we got epartial bronchus, hypartial bronchus, pulmonary artery, superior pulmonary vein, inferior pulmonary. Now we'll go back to the question. I think most of you can answer. All of the following structures are present in the mediastinal surface of the right lung except right lung is related to what? Right atrium. Am I correct? And the right atrium, what are the vascular structures that here they have not given right atrium in the option. They have given superior vena cava in the option, inferior vena cava in the option, azygos vein in the option. So all of the structures will open into the mediastinal surface. Arch of aorta is not related. So this is the answer. So arch of aorta is not related because arch of aorta will be there on the left side. Now this part, if it is asked what are the structures on the mediastinal surface related to this left atrium, sorry, not left atrium, left mediastinal surface. Instead of left atrium, we'll have left ventricle. On left part, mediastinal surface, instead of this, what will be there? Left ventricle will be there. That is the first part. then we will have arch of aorta. That is the second one, second structure that will be there. Then trachea also will be there, esophagus will be there. The difference will be here we have right atrium and superior vena cava, inferior vena cava. On the left side, we'll have left ventricle and arch of aorta. So here we saw arch of azygos vein. Azygos vein is what do you mean by azygos? Azygos and paired vein. Azygos vein is always present on right side. It is that we don't have a left azygos vein because it's unpaired. It will be present only on the right side. Okay, so left side we have arch of aorta, right side we have arch of azygos vein. There one arch is there, here one arch is there. Right side we have arch of azygos, left side we have arch of aorta. Then we move on to a topic in thorax which is commonly asked, is called bronchopulmonary segments. What are bronchopulmonary segments? What do you understand from the term bronchopulmonary? This is related to the bronchus and pulmonary. Now we got the right lung, we can divide them into, if we have a tumor on one part of this segment, we can just take out this segment. Okay, that is called broncho. Now what is the question? All of the following are true about bronchopulmonary segment except veins are intrasegmental, artery is intrasegmental, right lung has 10 segments used for surgical resection. We'll come back to this. So what are bronchopulmonary segments? Now we divide the right lung into, first, before this we can see one more part, then we will come to this. So right lung is there, left lung is there. You all know that we have a right lung. Okay, we got a left lung. Okay. Now, how many lobes are there in the right lung? Right lung has 3 lobes. Left lung has 2 lobes. And once again, lobes are not always to be precise. Sometimes there can be variation, but commonly. Okay. Now, how many fissures are there? We got an oblique fissure. We got a transverse fissure. Here we have only oblique fissure. Because of this fissure, right lung has called upper lobe, middle lobe, lower lobe. So what is the name? This is called transverse fissure. This is called oblique fissure. Because of this oblique nature, the fissure is called oblique fissure. We got a transverse fissure. So right lung is divided into 3 lobes: upper lobe, middle lobe, and lower lobe. Left lung, we don't have one fissure. That is called transverse fissure is not there on the left lung. So we have only upper lobe and lower lobe. Instead of this middle lobe, we have a tongue-like projection here. So it will be like this, almost. Okay. So it will be like a tongue-like projection. This is called lingular lobe. So instead of middle lobe, we got a lingular lobe on the left lung. Left lung has upper lobe, lower lobe, and a lingula. The heart is here. Cardiac notch will be there. That is also there. But lobe wise, we divide upper lobe, middle lobe, and lower lobe. Left lung will have upper lobe and lower lobe. Now we just understand here. Now this is the right lung. We'll see today. I think we'll see up to the thorax, and the remaining part we can cover tomorrow also. Okay. Now right lung is divided into bronchopulmonary segments. So what are the bronchopulmonary segments? If I'll just try to zoom it. Now right lung, we just saw that we got, this is the right lung, we got a transverse fissure and an oblique fissure. This is divided into an upper lobe, middle lobe, lower lobe. How many bronchopulmonary segments are there? We got 10 bronchopulmonary segments always on the right side. On the left side, we can have up from 8 to 10. It is not constant on the left side. It can be 8, 9 or 10. But on the right side, it is constant. We got 10 bronchopulmonary segments. They are numbered like this. Okay. We got 1, 2, 3. The upper lobe will have an apical, anterior and posterior. Okay. Now on this 5 is medial, 4 is lateral. On the lower lobe, we got an apical, anterior basal, posterior basal, medial basal, lateral basal. So in the lower lobe, what is there? We got an apical lobe, anterior basal, posterior basal, medial basal, lateral basal. Okay. Why I have not put the 7? Because 7 you can see only from the medial side. This is called the medial basal. This is the hilum. We can see only from this side, the 7th lobe, 7th segment. Okay. So 1, 2, 3 segment are present here. Apical, anterior, and posterior is there on the upper lobe. Lateral lobe is present on the middle lobe. The lower lobe is divided into an apical part. This is the apical segment. Basal is all are basal. Basal is anterior basal, posterior basal, medial basal, lateral basal. You just imagine a three-dimensional structure on the lower lobe. We got an apical segment, we got an anterior basal, posterior basal, medial basal, and lateral basal. All this constitutes the lower lobe. This medial basal can be seen only from the medial surface, mediastinal surface. Now here also the rule is almost same. The difference in the left lung will be I'll try to zoom it here. Okay. Now, what is the difference? The difference is there on the middle lobe only. Okay. The difference is there on the middle lobe. The fourth and fifth segments sometimes will present on one segment, that is called the lingular lobe. Here also apical, anterior, and posterior. The basal part or the lower lobe segments are same. The lower lobe segments are same, that is apical, anterior basal, posterior basal, medial. This is medial. Medial basal is 7th segment. Lateral basal is 9th segment. That is same. Only the difference will be there on the 4 and 5. Okay, the 4 and 5 can happen as a same segment, that is called lingular lobe. That is there. That is why the lobes, the number of bronchopulmonary segments is not constant in case of left lobe. It can be from 8 to 10. But on right lung, if they ask you, it is constantly, it is 10. So right lung will have 10 bronchopulmonary segments. Now, what is this bronchopulmonary segment? Why it is having a concern? And the question is not directly broncho number, it is about some more structures. Now, bronchopulmonary segments will have an bronchus, pulmonary vein, okay, pulmonary artery, bronchial artery. Only one thing you remember, this pulmonary vein is intersegmental. Intersegmental. So pulmonary vein is going like this. Again, there is a reason why pulmonary vein is given as red color. The pulmonary vein is actually drawing the deoxygenated blood and going back to the left atrium. So it is actually, it should be drawn with the only vein we can draw with the red color is pulmonary vein. So this pulmonary vein, only remember this alone. Pulmonary vein is intersegmental. So it will take the oxygenated blood from this segment and this segment. So this is one segment. What is shape of the segment? It is not circular. One question was there in the FMGE, what is the shape of the bronchopulmonary segment? It is not a circular, it is like a wedge shape. This is a wedge, it's not triangular, it is a wedge. Wedge will be like this, no? Okay, I couldn't draw the three-dimensional of a wedge. So this is a wedge. So this is a wedge-shaped segments which got an apex, we got a base and some surfaces. So this pulmonary vein will draw from this also, this also. Pulmonary vein will draw oxygenated blood from both the pulmonary segments and then join together to form a pulmonary vein. This is a tributary of a pulmonary vein or a branch of pulmonary vein which is going there. Okay, so this only remember. Between two segments will have pulmonary vein. Okay, then within the bronchopulmonary segments, what are there? We got to come here and divide into alveoli. This is called alveoli. So each will have one terminal bronchiole that will divide into respiratory bronchiole. Then we'll have alveoli. All this part will be there in the within a bronchopulmonary segment. So we got a segmentation of the bronchus because primary bronchus, secondary bronchus, tertiary bronchus, terminal bronchiole, respiratory bronchiole, alveoli. This is the bronchial tree if you read. So that up to this part will be there in the bronchopulmonary segment. That is a black color. What is that? It is nothing but the bronchial tree up to the alveoli. This space is called the alveoli. Now we have blue color. What is this blue color? Blue color is nothing but pulmonary artery. Again, pulmonary artery branch will be there within the segment. What is this red color? This red color is the bronchial artery. So bronchial artery, pulmonary artery and bronchus will be within the segment. Only which is between the two segments, intersegment will be the pulmonary vein. So pulmonary vein is intersegmental, all others are intrasegmental. Which is intersegmental? The branch of the pulmonary vein. We'll go back to this question. So which is intrasegmental? Ideally the question should be the pulmonary vein. The pulmonary vein is, which is artery is intrasegmental? Yes, it is correct. Right lung is always has 10. Yes. What is the use? I will come. This is also a correct answer. So it is not intrasegmental, it is intersegment between the two segments. So pulmonary vein is usually intersegmental. Now, what is a surgical resection? The surgical resection, if you have a tumor on one bronchopulmonary segment, we got a tumor on apical vessel, the segmental resection is possible unless it is infiltrating to the other segments. If it is there, you cannot do. But if it is restricted to only one segment, segmental resection of the lung is possible only because of the pulmonary segments, bronchopulmonary segments. This is used by in surgery for segmental resection of the bronchopulmonary segments. Okay. So these are the commonly asked core topics. I have tried to cover as much as possible in the thorax. Surface marking, external features of the heart, blood supply of the heart, lungs and bronchopulmonary segments. So don't go to the exam without reading these topics. Okay. Some more topics are there related to the thoracic duct, that also try to cover up. Okay. Maybe we'll continue with the head and neck and the upper limb and lower limb in the next session. So just go through these topics, and if you have any doubts, you just post in the chat box. I thought I will finish by 1 hour. It's extended up to. Okay.